Hi, my name is Cam McCormick. I'm with Excel Physical Therapy and Fitness in Glen Mills, Pennsylvania. This is one of our multiple physical therapy offices in the Philadelphia area. And I wanted to just go over a couple of quick mulligan mobilizations with movement for the hip today. Often what we'll see is patients with hip restriction have either back pain or hip pain or even something as far down as foot or ankle pain. In terms of clearing hip restrictions, stretching goes only so far. So one of our preferred manual techniques is using Brian Mulligan's belt mobilizations. So we're going to do a couple for hip flexion, followed by a couple for hip internal rotation. And what I've got here is just a standard mobilization belt. The pad is just for patient comfort. And that's going to loop around the inner thigh and then back around my pelvis. The first thing I'm going to do is I'm going to fixate his pelvis against my thigh so we're not getting any excessive motion there. And so that's just acting like a lock. I'm going to bring him up to about 90 degrees, and what we're doing with the belt is just subtly I'm going to sit back just to provide a small distraction force to the hip. Once I'm set, patient's going to actively perform hip flexion, and I'm going to just move along with him. So let's go ahead and do 5 times knee to chest. And back down. 1. And I'm just maintaining the same distraction force as we're going along. Depending on your stage of rehab or patient comfort, it's very easy for me to add some overpressure at the end of this depending on what we're trying to achieve. Maybe one more. Good. Okay, so that's the mobilization with movement for hip flexion. Internal rotation is the exact same concept, but now we're going to work on internal rotation. So we're going to come back to the same start position. I'm going to block his pelvis, and this time you're going to rotate your foot out toward me, keeping your thigh vertical. So first comes the distraction, and now go ahead and rotate out and back in. For demonstration's sake, we're just going to do 5 here. 3. And same concept. I'm in a great position where if I wanted to add a little bit of overpressure, it's very easy for me to do so right there. Back down. You want to make sure that these techniques are pain-free. So you may not be working to end range right away, but we're finding more rapid improvements in terms of hip mobility, so we can progress to more aggressive stability and or strength work down the road.